Welcome to Diabetes Decoded, a concise guide to diabetes mellitus that blends scientific insight with clinical perspective. In this presentation, we'll explore what diabetes is, how it develops, and why it matters for long-term health, guided by diagrams like a glucose meter and pancreatic icons, to frame the story from basic mechanisms through modern management strategies. This slide breaks down diabetes into three main categories: autoimmune type 1, insulin-resistant type 2, and other specific types like gestational and monogenic diabetes. Type 1 stems from V-cell destruction and lifelong insulin dependence. Type 2 accounts for roughly 90% of cases with insulin resistance and progressive V-cell dysfunction, and the other types add diagnostic complexity, requiring tailored approaches. Here we focus on how visceral fat drives insulin resistance. Excess visceral adipose tissue releases inflammatory cytokines and free fatty acids that impair insulin signaling through serine phosphorylation of IRS proteins. The slide also highlights amplifying factors like genetic polymorphisms, high fructose diets, physical inactivity, and gut dysbiosis, all of which promote ectopic lipid deposition and accelerate metabolic dysfunction over time. This page explains why V cells fail, showing two complementary pathways: metabolic and cellular stress from chronic hyperglycemia and lipotoxicity induce oxidative stress, stress, and amyloid deposition that trigger VI cell apoptosis, while autoimmune destruction in type 1 involves CD8 plus T-cell infiltration and autoantibodies targeting V cells, ultimately producing absolute insulin deficiency in affected individuals. Long-term complications arise from persistent hyperglycemia driving non-enzymatic glycation and inflammation, forming advanced glycation end products that cross-link proteins and activate inflammatory pathways. Over years, this process damages retinal capillaries, causing blindness, renal glomeruli leading to nephropathy, and peripheral nerves producing neuropathy, so sustained glucose control is critical to slow or prevent these progressive tissue injuries. Diabetes markedly increases cardiovascular risk through two main routes: accelerated atherosclerosis driven by endothelial dysfunction, LDL glycation, and platelet hyperactivity that raises heart attack and stroke risk, and diabetic cardiomyopathy, where fibrosis and microvascular rarefaction cause heart failure, independent of coronary artery disease, emphasizing why cardiovascular prevention is integral to diabetes care. Diagnosis relies on clear biochemical thresholds and targeted screening. Fasting plasma glucose of 126 mg/dL or higher, a 2-hour OGTT of 200 mg/dL or greater after a 75-g glucose load, or an HbA1c of 6.5% or above, with random high glucose plus classic symptoms also sufficient. The slide emphasizes screening high-risk groups, standardized lab protocols, point-of-care validation, and early detection to prevent complications. Continuous glucose monitoring and flash systems give near real-time insight into glucose dynamics by measuring interstitial glucose with a fine filament sensor and transmitting 1 to 5-minute readings to a smartphone. The time in range framework targets about 70% in range, reducing hypoglycemia and guiding therapy adjustments, which helps improve HbA1c and supports more precise, data-driven diabetes management. Lifestyle and behavioral strategies form the first line of defense, using structured programs that combine moderate activity, about 150 minutes per week, weight management aiming for 5 to 10% loss, and Mediterranean-style dietary approaches. Digital coaching, peer support, and behavioral economics help sustain adherence, and these foundational interventions often reduce HbA1c by meaningful margins before pharmacologic escalation is considered. The treatment landscape spans foundational metformin therapy, adjunctive agents, and insulin systems. Metformin remains first line for type 2, lowering HbA1c by 1 to 1.5%, while GLP-1 receptor agonists and SGLT2 inhibitors offer weight loss and cardiorenal benefits. For insulin-requiring patients, basal bolus regimens and advanced closed-loop systems aim to mimic physiological secretion and improve postprandial control. Emerging approaches are moving toward functional cures, with stem cell-derived V-cell implants that use encapsulation for immune protection to restore autonomous insulin production, and gene therapy, or viral vectors delivering insulin or GLP-1 genes alongside CRISPR strategies to correct autoimmune drivers. Early clinical and preclinical results are promising, suggesting the potential for durable glycemic control and reduced dependence on daily injections. Personalized care shifts from one-size-fits-all to individualized algorithms using stratification tools like polygenic risk scores, pharmacogenomics, and gut microbiome profiling to predict drug response, combined with AI-driven decision support that integrates wearables, diet logs, and CGM data to optimize personalized insulin dosing, lifestyle coaching, and therapeutic choices tailored to each patient's unique profile.